unites SSP Sensory Considerations. Sensory processing refers to how we take in information through our sensory organs and receptors, including our eyes, ears, nose, tongue, skin, and internal organs, lungs, stomach, heart, and how we interpret and act on that information. Sensation may be conscious or subconscious and may give rise to shifts in autonomic state without any awareness of the cues that caused it. This is what Dr. Porges calls neuroception, the subconscious assessment of cues of safety or threat from our surrounding environment via our senses. As providers, we become sensory input for our clients through our interactions with them and by simply being in their space. We have influence on their nervous system and they have influence on ours through both neuroception and co-regulation. They see us, hear us, feel how close we are, and can detect our state through our voice, facial expressions, gestures, and movement. In addition, as providers, sensory elements of the listening environment can play a large role in supporting positive outcomes of the SSP. We encourage you to use the following suggestions to explore with your client and support them as they complete their SSP journey. Remembering that sensory preferences, or the way that a person experiences and responds to sensory input, are unique to each individual and may change over time and even during a listening session. Here are some specific sensory considerations to keep in mind when planning and delivering SSP sessions. Visual. For many clients, the visual system is the strongest sensory system of the body, and thus often the most distracting or stimulating. Changing the type and amount of visual input can be supportive or unsupportive. What is lighting like? Is the lighting dimmable to allow for the client choice of lighting? Low lighting tends to be less stimulating. Use of ambient lighting or white string lights can create a soothing atmosphere. Bright fluorescent lights tend to be alerting and less calming. Fluorescent lights may also emit a buzzing or humming sound that can be activating. They may also flicker, which can cause overt or covert visual disturbance. People of different ages may enjoy handheld fiber optics, visual toys that light up like a flashlight, or even a nightlight or lava lamp can be helpful. Auditory. When delivering SSP, it's important to choose a quiet space that will not be interrupted by loud sounds. However, full quiet can make some people nervous. Consider the use of a white noise machine outside the door to dampen noise from outside the SSP delivery room. Discuss with your client what sounds they may hear in between sessions and the impact this could have on their nervous system. Be mindful of how you speak when greeting or in having conversations with your client, and be sure to use accurate inflections and speak clearly. Vocal prosody can be a clear signal of threat or safety. As discussed, provide your client with control of volume level. Help them find that just right volume level that doesn't require straining. What sounds quiet to us may not be quiet to another person. Touch. The sense of touch is very personal. Our skin is where we as people stop and the rest of the world begins. What are the textures and tactile experiences of your client? Would they benefit from a soft blanket or pillow? Does your client have a weighted blanket they like to use for listening sessions? Is their clothing comfortable or distracting? Do they like holding onto something while listening? Are they fidgeting with their hands or itching, rubbing, or scratching? Would hand lotion or a handheld item be helpful? Sitting in a beanbag chair can create deep touch pressure that is soothing for some, whereas others might prefer a more firm sitting surface. Your client may prefer incorporating elements of touch into sessions, such as massage, either from the provider, if it is in their scope, or a caregiver parent. Be sure to ask your client and observe for client preferences when it comes to how close they want to sit to you or others, how much pressure they prefer, and the location of any touch or tactile input. Monitoring for preferences, including what may be aversive, helps to create a felt sense of safety for your client. Finding mutually enjoyable tactile experiences for co-listening sessions can be helpful, especially for children. Be aware of not imposing touch, but if a client seeks it, consider what type of touch is safe and respectful, even if offered via an object versus yourself. Proprioception and positioning. Consider your client's position and the possible benefit of changing positions throughout the session. Encourage good postural alignment to support optimal breathing, which in turn supports regulation. Sitting in a beanbag chair or lying on one's stomach or back feels very different. You may offer your client several options for positioning. Observe the sitting position your client chooses. Is that comfortable to them, or is it a habit? Would they prefer to sit or lie on the floor? Do they want to stand and stretch? Your client may like to sit up against a wall for more stability, or maybe in a floor rocker for movement, or even a beanbag chair for more grounding. Sitting side by side with you rather than face to face may be more comfortable for your client. You may offer suggestions of a yoga pose like child's pose, or lying down, resting your head on a stack of pillows. Consider using a bolster or rolled towel to help adjust your client's position. Consider your own position and comfort as well. When you are physically comfortable, it's easier to attend to the cues of and support your client. Vestibular movement. Consider how the listening space is arranged and if there is sufficient space to move if your client seeks it. Your client may also benefit from room to complete a quiet activity sitting down. Consider how movement can be provided without it becoming too overstimulating or activating. You may offer pacing, walking, or rocking. Slow, linear, and rhythmic movement, like that from a glider rocker or a hammock, may be helpful. Rotary movement and gross motor activity is often stimulating, but for some, it may be needed to access a calm state. We'll discuss integrating activities momentarily. Rolling the head from side to side may offer supportive, subtle amount of vestibular input. Stay within your scope of practice when recommending any movements to your client. Taste and smell. Smell is processed differently and more quickly by our brains than other types of sensory input. It's important to keep sense neutral unless the client is specifically given choice in what scent is introduced. Some clients may like the scent of lavender, which is known to be calming. Some may like a scented candle, lotion, or air freshener. Cool peppermint may be appealing. Avoid the use of perfume, cologne, or heavily scented deodorant for yourself or on days you have listening sessions in order to be considerate of your client's nervous system. Some clients may have favorite smells that evoke memories, positive and negative. So asking about smell preferences can guide you to use smell in a supportive way. Cranial nerves, including the vagus nerve, send taste information from the tongue and esophagus to various parts of the brain. Some flavors are perceived through touch, pressure, temperature, and pain receptors, such as the descriptor spicy, for example. Taste contributes to a person's quality of life, daily routines, and even relationships. So providers are encouraged to consider the impact that client taste preferences may have on their overall autonomic state. It's best to avoid eating during SSP sessions, but providers may consider how the social act of eating together before and after sessions may contribute to or hinder a felt sense of safety for the client. Notice how the presence of food or even packages of food in the listening environment can have a significant impact on a person's nervous system. Interoception is the system responsible for the sensations in our organs, and it helps support and helps a person maintain homeostasis. Interoception is working even when a person is not aware of these sensations. It is where subconscious and conscious sensation converge. Our physiological state is very closely linked to internal sensations such as hunger or thirst, need to use the bathroom, tightness in the chest, heartbeat, and even our breathing. It's important to observe for and respond to cues clients give regarding these sensations and to consider them as suggestions for making change. That is, further titrating an SSP program, adding co-regulation, adding regulatory activities, and even asking for more information about a client's experience. For example, looking for faster or more shallow breathing, hand over the heart, complaints of nausea or sore stomach, or changes to avoiding patterns during or between listening sessions. Encourage the use of the bathroom and or getting a drink of water just prior to SSP sessions to encourage optimal comfort and relaxation during the session, as well as to minimize possible interruptions. Encourage attention to specific body sensations, such as these, when teaching autonomic mapping and when cueing your client to tend to their own nervous system. Body awareness, including awareness of internal sensations, can support a more regulated state and thus has potential to enhance overall outcomes of the SSP.